Welcome to the New York Professional Spotlight. Host Roman Kirzhner sits down with successful professionals from across New York to uncover the stories, strategies, and expertise behind their achievements.
Hello, everyone. Thank you for being on our podcast. Today's our guest is Anthony Liberty. He's in healthcare, but very specific healthcare business. And we welcome you to our podcast. Thank you for taking time and being on our show. The question that I have, the first one, can you basically give us a quick snapshot of your professional career and practice today?
Yeah, absolutely. First and foremost, thank you again, Roman, for having me here today. I'm, very excited to be able to speak to you today about my career thus far. But just a little bit about my professional background. I had actually started my early career in college admissions. And so essentially, I had worked for the University of Miami down in Florida, and I would go to different high schools and try to recruit students to come to the institution. And really kind of what shifted me from a job into what I consider now kind of a career really was the pandemic for me. So when COVID had hit and I was living in Florida at the time, I decided that I wanted to come to New York, do grad school, be a lot closer to my friends and my family. And so when I started, taking classes for grad school, I thought, okay, well, I have to now pay for this. So let me get a part-time job. And so I kind of figured what is, something that's very similar to college admissions. And I kind of thought about HR as a whole, because I know recruitment is part of that. And so I had started working part-time for a small medical lab called Sunrise on Long Island. And I had done that for some time. And after a couple months, I thought, this seems like a lot more practical of a career for me than college admissions. And so I decided to, complete my degree and then kind of make that full transition into HR. And so currently I'm at Bellevue Hospital, which is part of New York City Health and Hospital System. And I am a senior HR associate. So I support our employment, labor, and retention issues for a couple of our different departments in the facility. I've been here for about 4 years so far, and it's been a great journey thus far.
Great. It sounds like how it works for you in positive way. People moving from New York and move back to New York, and it works for you.
Yeah, it worked out well. And I mean, people, are continuously getting sick. And, the more people get sick, the more the more safe my job becomes. So, I mean, I don't want to ever, make fun of the pandemic, but I mean, to a degree, there's been that job security because of it, which, in this economy, I'm very thankful for.
Absolutely. And there's so many talented professionals in your business right now. What sets you apart and what comes naturally to you where other people find challenging?
Yeah, I've always just really loved talking to people, and I think I've always knew from a young age that I wanted to do something so people focused and front facing. And I think, human resources really does get sort of a negative connotation to it. A lot of people think, oh, if I'm talking to HR, I'm getting in trouble, and HR only wants to protect the company, not the employees. And I can say my team at Bellevue is, not that standard kind of HR that we tend to think about. We really do so much work with employee satisfaction and retention and just, really kind of want to continuously build on their feedback to really improve their experience coming here. And I think that, just me being this outgoing person and really being able to kind of show commitment to our employees, I think a lot of people's perceptions of me and my team has, drastically changed than I would think other people might think of in HR. And I think especially on the recruitment side, like I feel very passionate about Bellevue and bringing the right kind of person to Bellevue. And I think other people in terms of recruitment just call people because they need to close jobs, XYZ, and it's very more just transactional work, where I think why I'm doing is a lot more mission driven. So it definitely is a lot more human focused, and I think just like numbers driven. And I think that kind of comes across, and I think people really just kind of enjoy that interaction. And I think that's kind of what sets me apart from my peers.
Absolutely. And you just describing your business from different perspective. And it's after all, it's a people relationship business that you're in, and people relationship will be based on trust anyway. So that's what you are basically telling me, that the trust, and it helps you and helps other people.
Absolutely, because at the end of the day, I want to really really be able to dictate the positive work that Bellevue is doing, so that when I talk to whether it be a nurse, a physician, anyone that's interested in Bellevue, they're coming in with a really positive idea of what Bellevue is, and that I'm selling them on this like really great place that ultimately when they come here, they are having that experience, so that ultimately that translates to wanting to show up in a better mood every day and, providing better care for our patients. So there is that domino effect. And, I work with a lot of great individuals that I've hired, years in the past that are still at Bellevue that have said, like, thank you for reaching out. Like, I'm so happy I've come here. Like, you've really made my career. And this is where I'm going to retire. And I'm like, this is exactly like what I want to hear. It's
That's that's exactly the feedback that you want to hear from people.
exactly.
Yeah. And obviously, since you're in this business, you have challenges. And if you can share what the biggest challenge you've faced in your career, because you're active, you're young, you can share that experience. And what did you learn from that?
Yeah, I think the biggest challenge for me, I mean, there's just so many people that kind of go into the realm of HR. So it's, how do I, one, make myself stand out as a professional, as I kind of navigate the job market myself, like very early on, especially in New York City where you have millions and millions and millions of people. So how do I stand out? How do I get myself into Bellevue store now that I'm here, which was like its first challenge. I think early on at Bellevue, the biggest thing going against us was sort of the conception people have about Bellevue. Usually, when I tell people about Bellevue, they're like, oh, like that's a psychiatric hospital. Everyone there is crazy. And, while we do have a very big, psychiatric program, we do have so many other different, services that individuals can see. And so it's taken some time to really kind of get not only candidates and employees kind of perception change, but the community as a whole. And so, it's still something that actively I think some people still feel a little weary about, Bellevue and kind of its history. But the work that we do, not only in psychiatry, but across the board is phenomenal work. I don't think people kind of grasp the idea and the volume of the work that we do. We see close to 1 million patients annually, most of them being that like lower socioeconomic end of the spectrum, not of legal status here, so many different options and backgrounds. And so, it's great that once people are realizing that, oh, we are providing care to everyone, regardless of ability to pay, insurance status, like that is very admirable work. I didn't know like someone can go and, have a baby at Bellevue and like have it essentially be of minimal cost or get, life-saving surgery without having to foot a multi $10,000 bill, whatever the case might be. So I think perception is something that's actively worked against us, but as kind of we are bringing in new staff and like really kind of increasing the breadth of our programs and just the quality of it overall, I think the tides are starting to change. But like I said, still actively trying to work on that.
Absolutely. And people should know that probably financial status and insurance status will not prevent them to go to the Bellevue anyway.
Absolutely. We've just celebrated our 290th birthday this year, and never once in our almost 300-year history have we ever turned a patient away because they couldn't pay or whatever the case might be. And I think that's fantastic because a lot of, private healthcare facilities are looking to make money. Like at the end of the day, yes, healthcare is a business, but despite, the financial obstacles that the country is facing, despite, being a public hospital and getting cut, like funding cut left and right, we've never wavered in that mission. And I think that's just a great thing that Bellevue stands for.
It's critical, and it's very important to point it out so people will know about that and they will not be afraid to talk to you.
Absolutely. Absolutely.
And on the other side, do you have any exciting projects, goals, or innovations that you focus in for next, let's say, 6 to 12 months?
Yeah, absolutely. So one of the things that we launched a little while ago, it's called Bridge to Home. And essentially what it is a sort of transitional housing that Bellevue owns. So, kind of going back to psychiatry, we as in my team and I, so my colleague Siobhan, Naz, and I, we are working with our psych team, which includes Dr. Beepan Subidi and Dorothy Neal. And essentially, we are identifying psychiatric patients that we think, we can hopefully, under the right conditions and right treatment plans, sort of matriculate back into functioning society. So we have about 15 or so patients in this transitional housing. We have, social workers there, nurses. We have individuals that help them apply for like housing, apply for jobs, learn like basic finance and social skills. And hopefully, like I said, after about a year or so, get them into stable housing and sort of break this cycle of rehospitalization or, worse, ending back out on the streets and being homeless. And so right now, looking at kind of the last 10 months or so, it's been a great success. And so we are opening a second location and we are going to expand our first location by beds. So actively kind of looking at, how do we do that naturally with the resources that we have? How do we define scope of role? How do we better kind of identify patients that kind of meet that? And then working with, of course, like legal and public affairs to kind of get all the legal and the jargon, all that good stuff out. But it's definitely a really exciting process that we're making on. It's the first of its kind in New York City. So there's a lot of eyes on this project, and it's both fantastic from just like a career recognition standpoint to be the face of the HR aspect of it, but it's also kind of daunting in that, in the sense that, worst case scenario, it fails, which luckily that doesn't seem like that's going to be the case. But if it does fail, then, partially I would be to blame, but it doesn't look like it's going to go that way. So that's definitely something that we're really excited to kind of grow and kind of get that, notoriety for.
Absolutely. And information for available programs and available sources is very critical and very important. Hopefully, we're helping people to get that knowledge from our podcast. That's important for them.
Yeah, absolutely. There's so many resources for everyone, regardless of, race, insurance status, like,
Yeah,
monetary background. So, any information that, individuals might say, like, oh, I'm interested in this program, like, could always come to Bellevue, and we're happy to provide them with community resources that would definitely, fit their needs.
absolutely. Congratulations on how things are going with your career.
Thank you. I
That's
appreciate
a little
that.
bit different aspect. Many professionals in your career um, doing really well financially when they working, but if they will stop working, their income and may
Yeah.
slow down or maybe dried up. Some of
Mhm.
them are looking forwards to a future when they want to keep the level of income the same high, but
Yeah.
not work so hard. Some of them looking to create additional income outside of work. They put in money in the stocks, funds, bonds, crypto. What is your thoughts on creating income outside of work?
Yeah, I think that's so important as well. I think especially with how increasingly expensive things have become that, it definitely does not hurt to have some sort of income on the side, whether it's, a second part-time job, investing in, real estate and renting that out. Absolutely. My parents are very financially literate. They both got to retire in their mid 50s, which is, very abnormal. And like, luckily, they've passed on that sort of trait to me. So, I've always delved in, investing myself. Like, I have a wealth manager who goes out and kind of invests in different stocks for me. I have a pension through the hospital, so that's going to be something that I'm going to get. And then also, in my free time, in terms of hobbies, I do a lot of long distance running. So I do, a lot of marathons. And I'm also a competitive fencer. So there is that as like a stream of income. It's not a lot to go off on, but it's definitely something that helps. Because yes, while I do, do well financially, like extra dollars, I don't think anyone's ever complained about having, more money. But yeah, I think it's so important, especially as a young person with, time on their hands, no family right now, no children. Why not just, make better use of my time and get more money?
Absolutely, nothing wrong with that.
Absolutely.
And that probably the last question. If someone wants to connect with you and learn about your work, what the best way for them to do that?
Yeah, they can always, connect with me on LinkedIn. I have a relatively large, following. I think I have about 27,000 followers. So connecting with me, shooting a message and saying, hey, I'm interested. Can we set up a phone call? That's always a great option. Individuals can always reach out to me on email as well. Instagram, any social media, I'm readily available. So definitely love to talk about my job. I also love to give unsolicited advice to people, even when they might not want it. So, when anyone ever has any questions or just wants career advice, I'm always just around to talk to anyone.
Absolutely. When someone likes what they do, it always shows, and it shows today.
Oh,
That's
well, I appreciate that. Thank you.
Thank you. Thank you, Anthony. Thank you for your time, and it's been great. My pleasure to meeting you today. Thank
Absolutely. Thank you again for having me.
Thanks for listening to the New York Professional Spotlight. If you're a successful New York professional with insights to share, visit nyprofessionalspotlight.com/guest and apply to be featured on the show.